Hello and welcome to Planet Outlook. My guest today is Dr. Jaideep Gogtay. He is Cipla's Global Chief Medical Officer. Thank you, Jaideep, for joining us on Planet Outlook.
Thank you for having me.
Doctor, I want to begin by asking that air pollution has dogged headlines for several months now. There are reports which are suggesting that we are losing about 5 to 9 years of our lives due to air pollution kind of thing. So just tell us, give us a sense of the picture, because you and your medical fraternity are closely observing this crisis and the respiratory burden in India.
So India has a very unique, I think, respiratory burden profile. And I would say it in two ways. One is we have a large number of people who live with chronic respiratory diseases, and that's probably about 8 to 9 crore people. And on top of that, we have certain risk factors like air pollution. And when we talk about air pollution, there are two pollutions we look at. One is the ambient air pollution, which is really the external air pollution, which comes from, say, vehicular exhaust, industries, or in big cities, especially roadside dust, right? And such other factors. The second is in the rural areas, there's a fair bit of indoor air pollution, which actually has been going down. Earlier, this indoor air pollution was because of use of cow dung, leaves, twigs for burning fuel, for cooking food and also for keeping yourselves warm. So we've always dealt with these two types. The indoor used to be worse than the outdoor till some years ago, but with some improved schemes, I think this has come down. But the external air pollution still remains a very, very a big cause for concern.
There is also indoor air pollution in our urban areas, in our home, in our school, in our offices.
Yeah, so there is air pollution of a different kind. For example, dust and dust mites. This could be allergens. So we've got very different types of air pollutions in different parts of the country and in different settings. While we have some very good data coming out on the external air pollution, I think the indoor air pollution needs to be looked at more closely. So we started off many years ago from Pune city.
Okay.
Many years ago, Cipla established a foundation there, which is now independent, and that foundation has done some remarkable work. In fact, they were responsible for gathering data on the global burden of disease in India for respiratory disease. They were responsible for a very important study in the past called as the Poseidon study, which brought to the fore that respiratory diseases are the commonest reason why a patient visits a doctor across all age groups. So whether you take early childhood or late, the commonest problem with which a patient goes to a doctor is actually chronic respiratory disease, followed by others. And they brought this to the attention of the policymakers. And I understand that now COPD is a part of the non-communicable disease strategy of the government of India.
So what about lung health at this point with COVID, with air pollution?
Unfortunately, India is a very fertile ground right now for chronic respiratory problems. Other than the numbers that I mentioned, which is about 8 to 9 crore, in addition, because of these risk factors like air pollution, repeated respiratory infections, what's also not very well known, but has been shown in one or two studies, is that the lung function or the capacity of the lungs in India is a little lower than what has been reported in the West, probably about 15 to 20% lower. So many people in India may already be sitting on a relatively lower lung function. And on top of that, we are exposed to a number of such noxious problems. And this may, in fact, heighten the problem of chronic respiratory disease. And I want to add here, Ananda, that other than the numbers, there's one or two very startling facts. India contributes to about 13% of the number of asthma cases in the world, but contributes to about 42% of asthma deaths. So we have a disproportionately high number of asthma deaths. And there could be many reasons. One, of course, could be the factors that we talked about, but there could be any reasons. And therefore, I think the burden of lung disease, we've got to look at it in many ways. And I think finally, to your point on COVID that you mentioned, Anda, obviously post-COVID, we are now understanding how the lung could get affected in many people. About 10 to 15% of patients who have recovered from COVID, particularly if they've been hospitalized, continue to complain of breathlessness several weeks after they have gone home. Secondly, CT scans which have been done of some of these patients subsequently have shown fibrosis in many of these patients, which probably they did not have earlier. And this is right now under heavy study that in some susceptible patients, does COVID actually trigger off an occurrence of lung fibrosis, where the lung tissue actually gets replaced by scar tissue, and could this contribute to further impairment of lung health as these people go ahead?
Is there a particular age group which is more vulnerable?
So typically, the elderly people are more vulnerable to the effects of COVID. We know that. In addition, if you already have some compromised lung function, such as in patients of COPD, and as we know, COPD is an extremely common problem in India. So a severe COPD, presence of significant other lung diseases may all contribute to actually worsening of the health problems of the lungs in our country.
My quick last question is, what are your kind of prescriptions to people of all ages who are watching this?
I think most important, I really think, is simply for people to be educated about lung health. You know, all of us are so concerned about the heart and diabetes and cancer and now COVID. How many of us really think about lung health, through which we actually get oxygen, and that's the one which actually goes all over the body? And it's very important for people to realize the importance of lung health.